Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we're talking about our upcoming symposium right now, and that is going to be our Tongue Tie Symposium 2021. I am so excited to tell you that we have 2 full days of engagement and learning with 5 presentations on each day. That's 10 in total, which just feels magical because I know how much information is out there right now. And we have brought together so many amazing, researchers, presenters, clinicians. I know that you're going to be wowed by what's happening. I think this year, more than ever, we're seeing big shifts in the field. So get ready, get prepared. You're going to need this information in order to feel confident and move forward with your clients. I know your families are definitely going to appreciate it. Well, today we're sitting down with Melissa Cole, good friend and colleague. So glad that you're back with us, Melissa, and happy that you're going to be talking at this conference. But first of all, why don't you go ahead and introduce yourself and tell people a little bit where you are in the world and what you do.
Absolutely. Thank you for that warm welcome. It's always fun to be here with you. I am in Portland, Oregon, so northwest side, and it is summer and hot, and I'm enjoying a little bit of time with my kids before they head back to school, hopefully safely. And have been busy with, I think, the summer baby boom like everyone else. Yeah, lots of babies right now needing support. And I am equally as excited to hear from other speakers this year and learn.
Yeah. I introduced this today saying that I felt that there has been the biggest shift again this year. Are you kind of getting the same sense that you're collaborating more, you're seeing more, folks involved in tongue tie as well?
Absolutely. And it has been growing, right? This collaborative awareness and
Yes.
multi-layer approach has been growing and brewing for several years now. And I think we're really seeing dynamic connections, multidisciplinary collaboration. It's very exciting.
Yes.
And I'm excited to be a part of it. And I love to keep this open mind around the topic and that there's so much more to learn. And it's okay to pivot and switch. And as we learn more, change how we practice, right? That's what we should have keep evolving together.
That's right. Yeah, we got to keep evolving. And that change in practice, boy, that's a tough one. But you and I both know that things have really changed over the last 10 years. I remember in the infancy of, even looking at a tongue tie and going, well, that's definitely a tongue tie because it's anterior and I can see it pinned down. Little did we know at the time that there was so much more, going on. But I am so grateful to all of my colleagues out there who have worked tirelessly, to bring the latest evidence and research and the research papers that have been in play. It's just amazing, really, that we've gotten to this point right now.
Yeah, absolutely. And there's always room for more research. But as you know, it's a difficult topic to get ethical approval to study certain things on neonates. And so we're all doing the best we can to answer big questions, to do meaningful work and really to provide the best care and continue to learn more and grow more and how we assess, treat, and care and time mindful support for tongue-tied infants.
Yeah, absolutely. Absolutely. Well, we'll talk. I'm going to talk more about your actual topic in just a moment, but I wanted to just go back and ask you a couple of questions because I know that you're doing some work in herbalism, and you can correct me. I know you have a very special title in this as well, but this is something that you're very passionate about, and I'm just curious if this is something that you have worked into tongue tie families as well, or families in general. Can you tell me? I don't know, Melissa, tell me what's happening in that area.
That's a great question. So I am a clinical herbalist, and it's always dovetailed well with my infant feeding and lactation practice in that families need support on all different levels. And so while I wouldn't say it's directly tied into the work that I'm doing, many times we will see accompanying parents having supply issues,
Right.
pain, damage, postpartum mood concerns. So many things that maybe aren't tongue tie specific, but that come along with the whole package deal of parenting a tongue tied infant and dealing with feeding challenges. So that being said, in families that are interested in learning more about botanical options, I like to be able to give them enough information they need to make an informed choice about something they may want to know about or utilize to support whatever issues they may be dealing with. So that is a big part of my practice for families that are interested in exploring how herbs may help other accompanying issues they're dealing with. Right. And I also enjoy teaching other professionals about it.
I was going to say, because I was teasing you about your book. So that's yes. TBD
in the works.
Yeah, in the works. But yes, I know you actually have courses and such and teaching professionals in this area, which it is an area where I feel is still sort of underdeveloped as clinicians. So maybe some guesswork, or a family, family will tell you what they're taking or what's in their diet. Right. And it's hard to have some of those answers. Do your courses sort of cover some of that and then beyond?
They do. And one of the newest developments that I'm working on and is actively a sort of a work in progress that's out there is my herbal database for lactation and postpartum, where sort of a medication that mothered milk, but for herbs. So clinician can look up and see, all right, what are the herb drug safety issues, contraindications, available evidence. And it is sort of that at your fingertips bit of information that is really for clinicians to give families informed choices and give them comprehensive information.
Right. Well, it's very much needed in our communities. So thank you for working on that and continue to grow that area of work. I know there's going to be many folks that are going to gravitate towards that and find it really useful.
Thank you.
All right, let's talk about the topic you're going to be talking about, because this is also something that I know that you're doing and working on. So Melissa is going to be talking about connection and care, virtual support for tongue-tied infants. All right, Melissa, so tell me, who is this presentation for? Who needs to attend this presentation, first of all?
Well, everybody, of course. But that being said, I mean, we know telehealth virtual learning or virtual care providing is not new, but I think most of us have had to pivot and incorporate more virtual care, regarding what type of care you provide. Most of us are finding we need to do it virtually now more than ever. So I think regardless whether you're a lactation consultant or other type of clinician working with families, being able to provide quality virtual care is important, and it will probably stay in our care circles for a long time. I don't see it going away. Right.
Yeah, absolutely. And I think that that's part of, part of the solution is that we need to come together and learn from each other how this works. There's no real specific training on it. We are, we're all working together. And I know that's part of, what you're going to be showcasing with us, during this presentation, which is going to be great. And I think some of the myths behind this, and I'm just going to put it out there, is just because you're a person that's online, like myself, it doesn't mean that the next step into virtual consults is any easier than for a person who's not perhaps online, So that was something that we were talking about today, Melissa.
Absolutely. And I think it also doesn't have to be something you shy away from just because you think you haven't done it before, or that you might not know what to do. And that a lot of times we're sort of extrapolating, what do we do in person that we're really good at? And how can we do that in a virtual environment? And I think we tend to think that in-person care is the gold standard, and virtual is just sort of, suboptimal version. We do it because we have to. I want to flip that script and really highlight that it can actually be quite empowering to, when you are sort of forced to be hands off. You learn how to be more creative as a clinician, right? Well, how am I going to get this information? And it's empowering to the families because they're being, they're part of the hands-on assessment that maybe isn't always true in the office, and they get to gather more information and knowledge about what's happening with their child's oral anatomy or feeding in a really hands-on way. So I want to flip the script and say, rather than be scary or, maybe secondary to in person, it can actually be quite empowering for both the clinician and the family to work together to get the information we need and form a good care plan together.
Excellent. Yeah, I'm feeling you. You heard it here first. Everybody needs to be there. We're going to flip
Yeah.
the script and empower folks to feel confident in what they're doing, and that's me included. I want to be able to give my clients the best, but I want to do it in a safe manner. But today I want to be able to reach the families that perhaps I would have never have reached outside of the situation that we're in right now, because many folks could never be able to travel to see me.
Yep.
So there's lots of opportunity that we can talk about when it comes to virtual support. Well, wow, thank you so much, Melissa. It's just
Thank
been
you.
great sitting down, catching up with you,
Yes,
hearing what's happening.
I
And of
know.
course, so excited that you're going to be here live.
Yes.
So you'll also be able to bring your questions to Melissa at the conference. She's going to be with us for the Tongue Tie Symposium, which is on September 13th and 14th. You can go to the website right now at goldlearning.com. You can get all the times and dates when all of our speakers are going to be slotted in. Of course, it'll be in your time zone, which is excellent as well. Thank you once again to Melissa Cole for being with us here today. It's been great having you.
Thank you for having me, Fiona.
And thank you to all of our viewers. Once again, thanks for sticking with us. If you've got any comments or questions, you can pop them down below. We'd love to hear from you, of course, before the conference. But if not, come and join us on September 13th and 14th. And we look forward to connecting with you. Have a wonderful rest of your day, everyone. Bye-bye for now.
Goodbye.